Addressing a media briefing in Harare this Saturday, Health and Childcare Minister Dr. Obadiah Moyo warned that doctors who fail to comply will be in breach of their contracts of employment and will face a disciplinary action. The caution is for all categories of doctors, including those who fall under the Ministry of Health and Childcare, as well as university consultants.
Government has shown its sincerity by continuously engaging the health workers to address their challenges, including implementing programs that ensure that they have the needed medicines and equipment to deliver medical care. Their remuneration packages have been reviewed consistently in the context of obtaining economic climate. Government is therefore appalled that doctors walked out from the negotiating table and from their patients who are in dire need of their care right now. Government is grateful, however, to those doctors who remained on their post of duty delivering care, saving lives and alleviating suffering. For sake of saving lives of the patients, we now call on all doctors, whether they're from the Ministry of Health or from the University of Zimbabwe, to report to their posts of duty at 8 o'clock on Monday, the 7th of October, 2019. Those who fail to do so are reminded that they will be in breach of their contracts of employment and will have to face disciplinary action.
This Friday, all parties that participated in the Health Service Bipartite Negotiating Panel agreed to a 60% increment on health sector-specific allowances, but the doctors' representatives turned down the offer. Minister Moyo thanked those who have remained at work and revealed that government has reviewed upwards allowances for health workers.
The new allowance covers night duty allowances. It covers nurse manager allowances, on-call allowances, special health allowance, and a standby call-out allowance. The parties to the meeting also agreed on the locum rates for nurses and paramedics to be reviewed from the current $4 to $16 per day hour, and from $6 to $24 per night hour. Locum rates for doctors were also reviewed from the current $7 to $28 per day hour, and from $10 to $40 per night hour. The following were also reviewed in the manner prescribed below. Initial uniform grant reviewed from $75 to $300. Uniform allowance reviewed from $75 to $300. Psychiatric allowance reviewed from $20 to $100 per month. Out of residence allowances reviewed from $250 to $500 per month. Post-basic allowance reviewed from $70 to $150 per month, whilst additional post-basic allowance would be increased from $10 to $25 per month.
One of the reasons cited by doctors is that their remuneration is not in line with comparative remuneration trends in the region, and their employer, the Health Service Board, indicated that the amounts mentioned in the memo by senior doctors are not reflective of the true picture. For those who do not heed the call to return to work by Monday, the Minister of Higher and Tertiary Education will take appropriate action if any of their medical students do not comply, while the Health Services Board will take relevant disciplinary action in terms of provisions contained in the Labour Act.
The ministry, through its agency, which is the University of Zimbabwe, and through its processes, has got all the arsenal that is needed to deal with breach of conditions of certification.
Disciplinary actions that we have commenced in terms of the relevant provisions of the Labour Act, which actually states what disciplinary procedures need to be undertaken for those workers that have absented themselves from their workstation for at least 5 days.
Doctors have scaled down operations and are providing emergency hospital services. Janet Minyaka, ZBC News, Harare.